Amazing. Thank you, Lori, for that introduction, and thank you, Preet, for the breathing exercises. I appreciate that very much. So good afternoon, everyone. It's afternoon where I am. My name is Ashley Hayward, and I am a proud citizen of the Manitoba Métis Federation. And as Lori mentioned, a PhD candidate in Peace and Conflict Studies at the University of Manitoba. Really, my research focuses on addressing health inequities um, through kind of a multidisciplinary lens. And I'm here to talk to you today about the She Walks With Me project, the Urban Indigenous Doula Project. This initiative really combines Indigenous knowledge with health and social service care to improve support for urban Indigenous birthing people in Winnipeg, and we'll explore how we can foster culturally based care through an urban Indigenous doula training program. Before I start too much, let's just make sure I can control this. There we go. I wanted to give you a little introduction about me, which is pretty common in Indigenous ways of being and doing. So, you know, the lens that I bring to my work. I live in a community called Giroux, Manitoba, with my family on a 3-acre property where we really enjoy a close connection to nature. We raise chickens and we care for 2 large dogs. This is Treaty 1 territory. I've been married to my husband, Joel, for 15 years, and our life is filled with a lot of outdoor adventures like hunting and quadding and camping. I'm also the proud mother of 2 young women who you'll see here. Mika's a passionate U16 AA ringette goalie who excels in all sports, and she really inspires me every day. She enjoys all sorts of games and will play anything that you're up for. Maddie, on the other hand, combines her feminine side with her love for the outdoors. She enjoys spending time with her friends, archery, and also spending time alone. Their strength and individuality is really key motivators for me as I return to university 10 years after graduating high school to pursue further education. Throughout my journey, that's both personal and academic, I've come to value the importance of choice in birthing. My hope for my daughters, if they choose to birth one day, is that they have the freedom to shape their birthing experiences in ways that are meaningful and empowering to them, ensuring that the journey is safe, supported, and well aligned with their own values. So now about the presentation. If anybody read the blog, you'll know, but doulas are support folks who provide continuous physical, emotional, and informational support to a birthing person before, during, and shortly after childbirth to help them achieve the best birthing experience possible. While doulas aren't a regulated profession, and therefore they don't offer a standardized model of care, they can really play an important role for families. So traditionally, we had these roles in Indigenous families. So sometimes they were called birth helpers. We use the term Indigenous doula just to provide some familiarity with it. And they provide prenatal, birth, and postpartum care. And in some cases, they also played an important role during other reproductive life events, such as a first period or menopause. Indigenous birth workers tended not only to the physical aspects of healthcare, but also the spiritual aspects as well. In some cases, birth workers conducted ceremonies to honor the new infant and mother, and then were honored with ceremonial kinship responsibilities, such as the child's naming. Birth workers were therefore an important part of kinship structures, community life, sociocultural systems, and reproductive health and wellness. But to provide a general overview and explain how this project came to be, we need to place the project into the current context. So while Canada prides itself on being a multicultural nation, it still grapples with deep-seated racism within institutions affecting education, healthcare, social services, and beyond. This contradiction is starkly evident in the treatment of Indigenous people within systems, and we can see many examples of this within our own province of Manitoba, where I am. For example, in August 2014, there was a death of a young woman named Tina Fontaine in Winnipeg, which highlighted really the dangers that Indigenous youth face, a story that was echoed that same year with Rennell Harper's survival after a brutal attack just a few months later in November that same year. These incidences can spotlight the systemic neglect and underprotection that Indigenous youth face. So in 2016, the National Inquiry into Murdered and Missing Indigenous Women and Girls revealed the extent of systemic racism, accumulating in a 2019 report with 231 calls for justice. Racism isn't just limited to acts of direct violence. It really pervades the healthcare system, and we've seen that in our province with the case of the 2008 case of Brian Sinclair, a double amputee who was confined to a wheelchair who died from a treatable infection after being presumed to be homeless, using substances, and avoiding the cold weather in an emergency room. As a country, we also witnessed the 2020 case of Joyce Echaquan, an Indigenous woman subjected to racist abuse by healthcare staff in her final moments of life. So these aren't isolated incidents, but examples of really a systemic problem that extends beyond the very fabric of Canadian society, including critical events like pregnancy and childbirth. We have informal practices such as the birth evacuation policy that force Indigenous birthing individuals to give birth far from home, away from their cultural practices and territory, and away from local support systems that they might have. In Manitoba, the child welfare system's failure are epitomized by the story of Phoenix Sinclair, which revealed a system where Indigenous children were disproportionately placed in the care of child and family services, being separated from their biological and kinship families. The practice of birth alerts, which ended in 2020, really marked a step towards addressing these systemic biases, but the journey was far from over when we witnessed this new mandatory social work consult checklist. Just before I continue, I wanted to know if you know what is the percentage of Indigenous children in foster care in Canada, and maybe you can just share that in the chat. So 28.6%, 43.7%, or 53.8%. Yeah. So according to the census in 2021, 53.8% of children in foster care are Indigenous, but account for only 7.7% of the child population. In Manitoba, those stats are drastically increased, and you may have heard that 90% of children in foster care in our own province are Indigenous, and we'll talk more about that in a moment. Yep. So efforts really to empower Indigenous communities through the training of Indigenous midwives and doulas represent kind of this beacon of hope, aiming to provide culturally appropriate care. Yet it's a path filled with challenges, including the limited nature of midwifery programs and the competitive nature of those fields. The goal of our project, as well as that of other community groups who offer Indigenous doula training, is to ensure that Indigenous people in Canada receive care that's not only respectful, but also culturally appropriate, marking the beginning of much needed transformation in Canada's approach to healthcare and social services within Indigenous communities and for Indigenous folks. We've been in the process of developing an urban Indigenous doula curriculum that's designed not only to meet the unique needs of the urban Indigenous families in Winnipeg. This curriculum draws from experts that provide support to Indigenous folks and doula research that we've conducted, and it also integrates cultural spiritual support. Our goal is to create a holistic, culturally based learning experiences that doulas will in turn provide to Indigenous families that are empowering, respectful, and culturally appropriate, so that it's really the care that they deserve within their perinatal journey. Ultimately, we know that the community can guide what they know is going to work, and that it's important that we listen to that. The training curriculum aims to deepen Indigenous doulas' knowledge and understanding of different types of support while extending their scope of care. The curriculum equips these trainees with essential certifications and up to date training in areas that are critical for supporting birthing individuals. So that includes motivational interviewing, perinatal mental health certificates, infant CPR, first aid, and naloxone administration. Um, Well, there may not currently be Indigenous doulas specifically that specialize in arthritis at this time. Their wide scope of care and training and cultural knowledge really places them in an ideal position to care for a wide range of conditions that disproportionately affect Indigenous folks. In collaboration with our community partners, we identified a wide range of topics that are pivotal to the curriculum, which you can see on the slide. And so some of those are understanding sexual and gender diversity, promoting cultural safety and anti racism, understanding substance use and harm reduction strategies, navigating that CFS involvement and community resources, advocating on behalf of the clients within the healthcare system, supporting individuals with different abilities, and reducing barriers to care. So, a unique aspect of kind of this training and this program is the integration of self care and self reflection practices to ensure that the support workers maintain their well being while they're also delivering care. This curriculum is not really just an educational journey, but it's a commitment to fostering a supportive and knowledgeable and compassionate community of care providers who are well prepared to meet the diverse needs of Indigenous families within Winnipeg. By focusing on these comprehensive topics, we aim to create a holistic support of like a system that respects the cultural practices, addresses systemic challenges, and promotes the health and well-being of both the birthing individual, their newborns, and their families, as well as the person providing support. So once the content is completely developed, which will be this month, it will be reviewed by an Indigenous panel comprising of 4 experts, including a social worker, a two-spirit knowledge keeper, a midwife, and a nurse. This diverse group will use their expertise to ensure the curriculum is appropriate and aligns with the goals and values of the project. After the review, we plan to integrate their recommendations and suggestions into the curriculum. And this process is really about guaranteeing the curriculum not only meets, but actually exceeds the needs of the communities and their expectations. The next step involves presenting the curriculum after we incorporate any feedback to individuals with lived experience. So by hearing from those who have firsthand experience with our community partner organizations, we'll ensure that the content is relevant and useful for them. At this phase, we'll gather the feedback and make necessary updates to the curriculum to make sure their voices are also heard and involved. The pilot phase will allow us to test the training program in a real world setting and get feedback from both facilitators or trainers, as well as the participants. And that feedback, again, will make any necessary adjustments before a full scale launch that could be adapted to other local partner organizations and even potentially nationally. So we believe that this comprehensive approach to creating, oh, sorry, thank you. Comprehensive approach to creating an urban Indigenous training program in Winnipeg is not just about developing courses, but really a journey to empowerment, to education, and to excellence in supporting Indigenous birthing people. The challenges we see in Manitoba mirror a broad national issue of systemic racism, cultural insensitivity, and negligence within the health and social services. This has spurred a reevaluation of support for Indigenous people, notably through the resurgence of Indigenous doulas. This approach blends traditional birthing support with advocacy for body sovereignty, acknowledging the significant cultural and health impacts that are lost within our traditions. Our journey, shared with Indigenous health and social service agencies, reveals a complex landscape with more questions than answers often. It's evident that the healthcare and social service system often fail to provide equitable and safe care for Indigenous people. So the role of Indigenous doulas in this context is promising, but it's still uncertain. The integration of traditional birth workers into the mainstream health system faces significant barriers, including a system that's slow to change with health human resources and little incentive for mainstream certification. Despite these challenges, doulas are really crucial in advocating for Indigenous rights within these systems, offering hope for transformation, though this will never be a cure-all system. So for me, as I draw this presentation to a close, I'd like to leave you with a question to think about, and try and flip the slide again. Thank you. And invite you to share within the chat your thoughts on it. But based on the insights and stories that are shared in today's presentation and your own lived experience, what's one area that you believe needs to be included within the urban Indigenous doula training curriculum? Thank you so much for joining me today. I'm really happy to answer any questions that you might have.
Oh, thank you so much, Ashley. I mean, I think there's a lot to learn, and it seems like an amazing support. I know I had considered, hiring the services, because I mean they're not generally covered, by the healthcare system. So just curious, like for Indigenous people having a child now, like how would they go about, or could they access a doula, or just to kind of, I know your project is sort of moving forward and likely will provide broader access. So I just want to see like now versus what might be.
Yeah, so there is for hire Indigenous doulas that exist throughout the country. A lot of them have been trained by Zagitawin, which is a grassroots organization located right here in Winnipeg.
Yeah.
There is a group out in BC who's doing a lot of training, and they have a grant program. So it's a little bit convoluted, but their grant program, you have to be trained by DONA, which is Doulas of North America. And so lots of Indigenous folks don't want to be trained by that because there's lots of like mainstream content, but not a lot of cultural content. They don't find it very relevant. But Indigenous families can apply to get a doula through that program. And then they're kind of matched up and they can figure out a way to pay for it that way. So they're still for hire doulas, but they're grant funded. Our project, we pay the doulas a salary, so a living wage, so that they will have security within their own job and make sure that that balance of like taking care of yourself is based on not having to fight for more and more people to support to be able to fund your living wage. But what does that look like going forward once the research isn't here is one of the questions that we're working with our community partners on to make sure we're collecting the right evaluation evidence, the right data that they can then make a case for their funders to say, this really needs to be built into our budget. And this is how we showed that it worked, how it like improved health outcomes. One of the challenges with that is that you can collect data on everything, right? And so like, how do you find what is really going to make the difference so that it helps the government see the value in this type of support?
Yeah, for sure. Yeah, like I cross my fingers. I know that, as you mentioned, there can often be more questions than answers given the complexity of things, but just curious because I know, broadly speaking, for non-Indigenous people, right, it is sort of like you need to pay for it out of your own pocket. And like so many allied healthcare professionals, right? It's just unfortunately not something covered under our public healthcare system. So that is too bad, but I'm glad you're thinking of it, that's for sure. And so there are some ways.
Yeah. And we do see, I should say, we do see in the States what they're advocating for now is coverage through like a Blue Cross, like a type of insurance like
Right.
that. It hasn't hit Canada yet, but I do envision it will, so that at least if you did have a health spending account or you did have allied health professional coverage within your benefits, that
Mm,
potentially you'd be able to get a doula. But because
mm,
it's unregulated, one of the hard parts is anybody can say that they're a doula.
right, right. Yeah. Yeah, I know. Hopefully we'll see the process evolve, because I often think back even in my own personal circumstances, how helpful that might have been. And I'm curious here, just one final question and I'll move on to Catherine, but the newborn care, infant feeding, postpartum, because a lot of people that live with inflammatory arthritis, like we're often told that we can flare, our condition can actually worsen after birth. We're told that our medications, we may or may not be able to keep taking them because often we rely on many prescription medications. So I'm just curious what it looks like. I could see that really filling an important gap for many people, including Indigenous peoples, because also Indigenous peoples in Canada do have a higher incidence of inflammatory arthritis. So I think this is particularly relevant for them, perhaps, in the afterbirth period. So,
Yeah, I think one of the things that the curriculum right now is working on is um, really basing it from a harm reduction strategy. And so thinking about that in terms of you are going to take your medication and you can still potentially breastfeed. And so what are the ways in which does that work for you? How do we hold the baby? Like what are those kinds of strategies? Um, it's not always easy because just like you said at the beginning, like this doesn't constitute medical advice. The doulas, because they develop such a deep relationship with the birthing person, sometimes their opinion becomes like medical advice. And so we do have to walk kind of a fine line to make sure that folks aren't going against what their OBGYNs or midwives or like actual healthcare providers are saying. That has created some problems in the past, and we've seen it. And it's created a lot of tension between kind of healthcare providers and doulas, and not all healthcare providers are supportive of doulas. So, we're trying to balance like an approach of like ask questions, have, it empower people through advocacy, empower people through providing information and letting people be the experts in their own lives to make the best decisions for themselves. And if something is what they want, how do you support them to do that? And so if they are really adamant that they want to chest feed, um, how do you support them to do that in the best way possible? So it's not about providing the medical advice, it's just about like from a harm reduction approach, you're going to do it regardless. So how do I make sure that we do it in the safest way possible?
yeah, right. Yeah, I know. And I mean, just speaking from my own personal experience, it was often quite painful managing the sort of chest feeding, breastfeeding, and I could have really used some support. And I'm sure I'm not alone in that during that period of time to help minimize the pain. So with that, I think, thank you so much, Ashley, and we'll come back with all of our panelists at the end.